Good afternoon, everyone. Myself Sakshi, PhD scholar at Center for Computational Biology and Bioinformatics, Central University of Himachal Pradesh. Today, I'm going to discuss on the topic the therapeutic role of yoga in hypertension, a bioinformatics perspective. So, let's begin with the introduction of hypertension. What is hypertension? Hypertension is also known as high blood pressure. It's a condition where the force of blood pushing against the artery walls is consistently too high. So, over time, this can damage our blood vessels and increase the risk of serious health problems like heart disease, stroke, kidney, and more. This is a major public health concern which leads to cardiovascular diseases, that is CVDs. These are the disorders of the heart and blood vessels, and cerebrovascular diseases which affects the brain's blood vessels due to stroke or accident. The impact of hypertension is, out of the total hypertensives, only about 1 in 4 adults, that is 24%, have well-controlled hypertension. The major risk factors included in hypertension are coronary artery disease, cerebrovascular accident, cardiac failure, chronic kidney disease, heart valve diseases, and dementia. Dementia is the memory loss. Some of the management points are you can change your lifestyle like modifications in reduced dietary sodium intake, increased intake of fruits and vegetables, regular physical exercise, and yoga therapy. But yoga recently received more attention as a treatment modality for various lifestyle disorders. So I'm going to discuss about how yoga helps to reduce the hypertension and how some of the bioinformatics approaches also help to reduce the hypertension with the help of yoga. The role of bioinformatics in yoga and hypertension research is it can play a role in understanding the physiological mechanisms in hypertension and aiding in personalized treatment plans and optimizing yoga practices for reducing the hypertension. Now we will move to the yoga therapy part. What is yoga? How we can do it? And what are the major components included in the yoga? So let's start with the yoga part. Yoga is an art, a science, and a philosophy of living a healthy lifestyle. It's a union of body, mind, and spirit. The major components included in yoga are asanas, that is postures, pranayama, breathing, dhyan, meditation, shatkriya, cleansing processes, mudras, gestures, bandhas, locks, lifestyle ethics, philosophy, and spirituality. Now, we will discuss how yoga helps in managing the hypertension. As we all know that the major effects and benefits of the yoga. Some we will discuss in this. First one is stress reduction. We will discuss how yoga helps to reduce the stress. Chronic stress activities like the sympathetic nervous system leading to the release of stress hormones like cortisol and adrenaline, which can elevate blood pressure. Yoga, particularly practice like deep breathing and meditation, which helps to calm the nervous system and reduce stress response. Second one is it helps to improve the blood circulation. Gentle yoga postures and movements can improve blood flow and vascular function. We all know how yoga helps to improve the blood and regulate the circulation of the blood. So next one is regulation of the nervous system. Yoga helps to balance and maintain the autonomic nervous system, shifting the body from the fight or flight response to the rest and digest state, that is sympathetic and parasympathetic states. It also helps to increase the body awareness, as we all know that yoga plays a very significant role in awareness. Various yoga plans are going on, so it cultivates a greater awareness of the body sensation, including tension and discomfort. This awareness can help individuals recognize early signs of stress and take proactive steps to manage them. Other step and mechanism which help to maintain the hypertension through yoga is weight management. We can say this is the main uh, benefit of this, how to maintain the weight. Some styles of yoga can be physically active and contribute to the weight maintenance. Obesity is a significant risk factor for hypertension, so maintaining this risk through yoga can be beneficial. We all know that yoga helps to increase the physical strength. So practice yoga, which leads to a healthy lifestyle. Some of the recommended yoga practices in hypertension are Shatkriya, Sharir Sanchalan, Surya Namaskar, Asan, Pranayam, meditation, and Yog Nidra. Shatkriya is also known as yogic cleansing practices. Sharir Sanchalan, we can say warm-up practices like toe bending, ankle bending, knee bending, half butterfly, shoulder rotation, and neck movements. Surya Namaskar, we can call it as a sun salutation, and it includes a series of dynamic yoga posture in a specific sequence with meditative awareness practiced at low speed with breath synchronization. Asan, we can also know about the asanas, yoga postures for relaxation. They are slow, rhythmic breathing, awareness of the sensations at the nostrils. Pranayam include the regulated breathing practices, gentle deep inhalation, and slow longer exhalation like slowly. You have to slowly perform this activity. Meditation, formal practice, it focuses on a word, sound, prayer, mantra or a phrase. मेडिटेशन मेनली हम कंसंट्रेशन पे ध्यान देना होता है, जैसे concentration meditation is very beneficial for our health. And the last one is Yog Nidra. It is also known as yogic sleep or effortless relaxation. It includes relaxation practices that aware different body parts and breath, relaxation and imaginary. The duration we have to perform, like Shakti, I can perform 10 to minute, Tratak 5 minutes, Janleti once a week. Shri Sanchalan, that is warm-up activities you can perform 5 to 10 minutes daily. Surya Namaskar, you can perform 3 to 7 rounds as per your capacity. Asanas, you can perform 5 to 30 minutes. Pranayam, you can perform 5 minutes. Meditation 10 to 15, and yoga up to 45 minutes for relaxing your mind. Now we will discuss about some of the techniques included in Shatkriya. These are 6 methods included in this Kriya. First one is Dhoti, Basti, Neti, Tratak, Noli, Kapalbhati. Dhoti includes cleansing mouth, esophagus and stomach. Basti includes cleansing of large intestine and rectum. Neti includes cleansing nasal cavity and pharynx. Tratak includes purification of eyes. In Tratak, you can concentrate on and attention on only one object continuously for about 5 to 10 minutes. Like you can focus on a candle flame, or you can open your pen like this and put it in the front of your eyes and concentrate for about 5 to 10 minutes daily. This can increase your concentration power, and it also helps to purify your eyes. Noli helps to purify the small intestine, and Kapalbhati includes the purification of sinus activities. Next one is Surya Namaskar. Surya Namaskar, as we already discussed, it is also known as Sun Salutation. It is a sequence of 10 to 12 yoga poses performed in a specific flow, often practiced in the morning. You can see these 12 poses in this picture, how to perform, and how to perform I will discuss it about in the next slide, how to perform the Surya Namaskar step by step. Surya Namaskar practice also involves coordinating breath with movement. So the next one is how to perform the Surya Namaskar. The 12 steps included in the Surya Namaskar are: first one is Pranamasana, that is prayer pose. You have to stand with feet together, palms together in front of the chest like this. In second step, you have to inhale and lift your arms up and back. It is also known as raised arm pose. In third pose, Surya Namaskar, you Hastpadasana. This is also known as hand to foot pose. You have to bend forward from the hips, reaching for the feet. The fourth one is Ashwasanchalasana, equestrian pose. Step the right foot back and lower the hips. Fifth one is Dandasana, stick pose. Lower the chest and hips to the floor. Sixth one is Ashtang Namaskar, 8-pointed pose. Lie with the body in a plank position. Seventh one is Bhujangasana. It is also called as Cobra pose. Arc the back, lifting the chest and head. Eighth one is Parvatasana, which is also called as mountain pose. In this step, you have to step the right foot forward and then the left foot, forming a plank position. Ashwasanchalasana, now these four you have to repeat from the upper ones, like Ashwasanchalasana we have discussed already. You have to bring the left foot forward and uh, lower the hips. 10th one is Hastpadasana, that is known as hand to foot pose. Bend forward from the hips, reaching for the feet. Hast Uttanasana, raised arm pose. Inhale and lift arms up and back. Pranamasana, prayer pose. Return to the starting position, like you have to start with this position and you have to end with this position. Now, next one is some other journal asana gesture postures are, as I have already discussed about the Jalneti, that is Chatkriya. This is a Kriya you have to perform once a week. And some more asana given in this picture, like Tadasana, Katichakarasana, Ustarasana, Gomukasana, Vajrasana, Makrasana, Vakrasana, Bhujangasana, and the favorite asana of all the individuals is Shavasana. In this picture on the right side, you can see the systemic benefits of yoga therapy. It's helped to improve your psychological, cardiovascular health, respiratory, and it helps to decrease the asthma attack frequency, increase the quality of life, and many more benefits. Now, the mechanism of yoga and hypertension. As we already discussed about the sympathetic and parasympathetic activities of the ANS. So Yoga helps to improve and balance these activities, and more activities like RAS activity. RAS is renin angiotensin aldosterone system. It is a hormone system that regulates the blood pressure. So, yoga helps to maintain and regulate the blood pressure through this activity, through this hormone system, or we can say. Uh, इट डिक्रीज द बैरोरिसेप्टर सेंसिटिविटी. बैरोरिसेप्टर मीन्स कि जिन पेशेंट्स में जो बीपी हाई होता है, तो योगा की हेल्प से वो बीपी रिस्टोर होके नॉर्मल पे आ जाता है जिन पेशेंट्स में हाई ब्लड प्रेशर की प्रॉब्लम होती है. सार्कोपीनिया भी होता है, एज रिलेटेड लॉस ऑफ मसल्स एंड मसल फंक्शन. सो योगा हेल्प्स टू मेंटेन दी sarcopenia level in individuals with high blood pressure, and or we can say that is hypertension. Next one is vasoconstriction, narrowing of blood vessels by small muscles. Yoga also helps to reduce these and increase your quality of sleep and reduce the mental stress, which is a major significant risk factor of the hypertension. नाउ जैसे कि हमने इतनी सारी योगा प्रैक्टिसेस पढ़ी, अलग अलग टाइप्स की उनके मैकेनिज्म्स पढ़े और उनका अब क्या इफेक्ट होता है, हम वो देखेंगे कि व्हाट इज़ द इफेक्ट ऑफ योगा प्रैक्टिसेस ऑन हाइपरटेंशन एंड द मैकेनिज्म ऑफ एक्शन. आई विल ब्रीफली, मतलब मैं थोड़ा थोड़ा बताऊंगी सबके बारे में कि कैसे जो डिफरेंट प्रैक्टिसेस हैं योगा की वो इफेक्ट करती है हाइपरटेंशन को और वो कैसे करती है. जैसे शतक्रिया है जो वो जो है इट हेल्प्स टू reduce BP and HR in patients with primary hypertension. The mechanism of action it includes that it induces calmness similar to a mental state during meditation. Next one is Shri Sanchalan. यू हैव टू परफॉर्म लाइक वार्म अप प्रैक्टिसेस से हमारी बॉडी जो प्रिपेयर होती है आसन की प्रैक्टिस के लिए. सो दिस रिमूव स्टिफनेस इन द मसल्स एंड जॉइंट्स एंड helps to improve your blood circulation. Surya Namaskar recommended for it. It is recommended for pre and stage 1 hypertension, and it produce psychosomatic harmony. मतलब psychosomatic harmony वो होती है, it's the state of balance and well-being where our mind and body work together to restore the balance of our body. Pranayam. Pranayam helps to improve the physical health, muscular strength, and flexibility. The mechanism of action of asanas, that is holding yoga posture for a few seconds builds strength by using body weight for resistance. Pranayam help to regulate breathing practices. It is effective in reduction of blood pressure and optimally balances stress response. Mudra induces sense of relaxation and it cultivates psychosomatic harmony, means it helps to restore the balance of mind where mind and body work together. Yoga Nidra, you all know the benefits of Yoga Nidra, like it helps to reduce depression, anxiety, and stress, and improves quality of sleep. The mechanism of action includes it helps to improve ANS, that is autonomous nervous system. Now, we are moving to the next part of our discussion, that is how bioinformatics play a major role in reducing hypertension with the help of yoga and different approaches. Firstly, we will discuss about role of bioinformatics in yoga and hypertension research. The major question arises, what is bioinformatics? In simple words, you can say it is the use of computational tools to analyze biological data. It helps to identify molecular changes and therapeutic targets. तो एप्लीकेशंस क्या हैं कुछ इसकी. It helps to track gene expression changes after yoga intervention. It analyzes biomarkers related to BP, inflammation, and stress. Like it helps to analyze the single nucleotide polymorphism and other many more differential gene expression levels. Some of the case studies included are studies showing modulation of inflammatory genes after yoga in hypertensive patients, and you also identify correlation of yoga-induced epigenetic changes with lower systolic pressure. This is the picture showing how the bioinformaticians work to analyze the biological data. Next one is how to apply bioinformatics in this major problem. So first one is data integration. Bioinformatics can integrate various data sets including clinical records, physiological measurements like blood pressure, heart rate variability, and potentially genetic information to provide a holistic view of individual responses to yoga. Second one is pattern recognition. It helps to identify patterns and correlation within large data sets, such as yoga posture and breathing techniques are most effective for reducing blood pressure. Predictive modeling. It helps to develop predictive models to estimate the potential effectiveness of different yoga for an individual based on their characteristics and medical history. मतलब उसकी किसी भी पेशेंट की मेडिकल हिस्ट्री की बेसिस पे हम मॉडल्स को डेवलप और उनकी पोटेंशियल इफेक्टिवनेस को आइडेंटिफाई करने में हेल्प कर सकते हैं. Personalized yoga practices by analyzing individual responses to yoga, bioinformatics can help to personalize yoga practices. Next one is mechanism of action research. It helps to understand the mechanism by which yoga reduces BP, such as, for example, nervous system, cardiovascular systems, and the balance of the body. And it also helps to identify risk factors that we also know that bioinformatics can help identify genetic or lifestyle changes in or which influence an individual response to yoga for hypertension, potentially leading to various lifestyle strategies. Now, some of the approaches used in yoga and hypertension of bioinformatics are: first one is differential gene expression analysis, comparing gene expression profiles in hypertensive individuals before and after yoga interventions to identify genes and pathways that are modulated. You can compare the before and yoga practices of the different individuals and identify the genes and pathways that are involved in the hypertension. How to identify the pathway or how to analyze the pathway, that is identifying the biological pathway and networks affected by yoga practices. This helps to reveal how yoga influences processes related to BP regulation. This helps to identify that how the yoga is reducing the blood pressure in the hypertension patients. Genetic association studies that investigating whether specific genetic variations influence an individual's response to yoga therapy for hypertension. Or the last approach you can use, that integration of multi-omics data, that combining different types of biological data to obtain a more comprehensive understanding of yoga effects. You can apply proteomics, genomics, transcriptomics, many more omics approaches to analyze the biological data and how the yoga interventions identify genes and pathways that are regulated. This is the picture showing how yoga affects gene expression and reduces chronic inflammation. As you can see that initial stressor, fight and flight रिएक्शन से NF-kB मॉड्यूल जो है वो गोज अप हो जाता है, ज़्यादा हो जाता है, जिसकी वजह से साइटोकाइन्स ट्रिगर हो जाते हैं, chronic inflammation हो जाती है, which increases the risk of depression, cancer and aging. So yoga helps to decrease and modulate the NF-kB molecule production. This is the picture showing the role of multiple factors in regulation of blood pressure, how these different organs contribute to the function of the increasing the blood pressure, regulation of blood pressure. Some of the considerations and recommendations are that you can consider yoga a complementary therapy and not a replacement therapy for conventional medical treatment. And you can advise individuals with hypertension to consult their healthcare provider before starting yoga. You have always consult a experienced doctor. And the next one is recommend practices under the guidance of a qualified and experienced yoga instructor and highlight the importance of consistency and long-term practice. Some of the precautions you can use that in case of physical injury, avoid practicing asanas. In case of pregnancy, you should consult a doctor before attempting the poses of various yoga asanas. And in case of recent surgery, you can recover from surgery. You individuals recovering from surgery should avoid these asanas. Now the conclusion, as we all know that what are the various benefits of yoga, but some I have listed are: yoga is a safe, holistic and effective tool in managing hypertension, and bioinformatics helps in identifying the molecular mechanisms and underlying therapeutic effects of yoga on hypertension. We all know that it helps to integrate physical, mental and emotional well-being, that is a union of mind, body and spirit. Bioinformatics also help to identify biomarkers to predict individual responsiveness to yoga for hypertension. Different yoga postures, breathing practices, and meditation are the three most components. You also have to remember these while performing and managing the hypertension. And last one is bioinformatics provides a deeper scientific understanding of mechanism and medicine and discuss future research directions such as larger scale multi-omics data and integration of bioinformatics with clinical trials. And this is the picture showing the benefits of yoga. It has to increase your physical strength, stretches your spine, keep your muscles strong, prevents joint problem, improves your posture, improve your metabolism, make you flexible, or say most importantly brings harmony to your life and make you helps to relax and make you happy. So these are some of the references I have used while studying this topic. And at last, I only want to thank you for listening me. Thank you.